So I want to consider how we learn about leading a major programme from the experience of the past 6 months of working in a crisis situation. And I want to do that from my perspective. I'm the SRO of a GMPP programme, and I'm also the Deputy Chief Executive of Public Health England, which has been at the heart of many of the initiatives over the last few months. The GMPP programme that I am the SRO for is the Science Hub programme, and that's also got a role with COVID, because the purpose of the programme is to create, for the first time in this country, a centre for applied public health science that acts as the innovation hub in the first stages of the response, and then gives the scientific underpinning to the work that has to go on across the whole of the public sector. So I've been thinking about what are the common skills that we need as leaders in both leading a major programme and in leading the response to what is in effect the greatest peacetime crisis that we've faced in the past 100 years. And although a programme and a crisis might seem very similar, I've got 4 similarities that strike me. First, both are a huge focus for public attention. They're in the public eye, and there's a massive expectation about what they should deliver. Secondly, they both have very specific goals. They are hugely complex tasks with multiple interdependencies, but success and failure is very obvious to people. Thirdly, to succeed, you need to create an effective temporary organisation, and we need strong leadership, team leadership, to lead that temporary organisation. And fourthly, the key leadership skill here is about judgment, because both crises and programmes face a massive time pressure. One is about an instant response to a crisis. The other one is about a timetable over many years sometimes, but that timetable is absolutely crucial in terms of cost and quality. And we're dealing with limited knowledge. There's always more that we would like to know. So I want to talk about 2 leadership skills that have really struck me in the work that I've been doing in the last few months, both in the programme and in the response. Sense making and learning. Sense making. So this is about really understanding what is important, not just to you as the leader, but crucially to the team and to the external partners and stakeholders. What's needed to meet the challenge is as much about how people feel in their hearts as it is about the rational plan that sits on the page. It was Carl Reich, the management guru, who invented sense-making, who showed that sense-making comes out of action. It's not a passive activity to do behind your desk. It's something where you need to get out and talk to people and see things. Sense-making comes from action, and that we need to use all sorts of data in order to do it, hard and soft data. There's a second task though. Understanding isn't enough. It's about communication too. So meaning making is taking this and putting it into a narrative that means something to motivate the team, to help them go forward. And this skill of combining meaning and sense making is something that's really struck me in the last few months. We have to have a balance between keeping to the plan and revising and adapting the plan. That's the way we handle the uncertainty and the time pressure. So in the COVID-19 response, where the nature of the virus is something that we knew nothing about at the beginning, and we've learnt quickly, but our knowledge is still very partial, very incomplete. And it's very easy to have hindsight and say, oh, if only we had known that, or why did they do this? So this ability to assimilate new information, some of which is very sketchy information, and build that into the way in which we deliver the services that are needed, we deliver the programme, is crucial. And that's what sense making is about. And we've had to redesign our programmes almost on the go. So we are delivering and designing simultaneously. And we've brought that into our approach around the Science Hub programme, so that we've had to reopen some of the options that we thought had been closed down, and that we've had to actively look at what are the inbuilt flexibilities, the scope for flex, without creating huge risk and uncertainty. Proactive learning. One of the things that strikes me in the crisis is that we all say that learning is important, but we don't put aside the time and the space in order to do that properly. And the same happens in the programme, even though it might appear that we have more space and we have more time. Leaders need to lead by example, prioritising the learning that needs to happen. And that learning is something that happens in real time. It's not an activity that gets left to the end. It's too late then. It may help other programmes and other crisis responses, but actually we need to do it now. So in the COVID-19 response, one of the things I've learned more about than at any stage in my career is this approach of red teaming, where you deliberately create an alternative group to help the main delivery team think outside the box, avoid the groupthink of the main team, by having that challenge, that constructive challenge from a group of colleagues who have a different perspective, who aren't in the middle of the response. And so, to conclude, sense-making and learning are both crucial activities. It's easy for projects to stop making sense or to feel that learning is too much effort. And my experience of the last few months has really shown me that amid all the challenge and the difficulties of the last few months, COVID-19 offers us a stimulus, a prompt to improve the way we do major programme delivery. And that's what the country needs. There is going to be a massive renewal and recovery phase, and major programmes are going to be at the heart of that. So I hope together we can look at the ways in which, going forwards, we can use the learning from COVID to make sure our major programme leadership skills are even better than they've been over the past decade. Thank you very much.